Thank you for joining today's webinar, Building Opportunity 2 Generations at a Time, and for your interest in this topic. I'm Jim Horan, Executive Director of the Connecticut Association for Human Services. My partner for today's webinar is Liz Fraser, a Policy Analyst at CAS. First, a little background about our organization, the Connecticut Association for Human Services. CAS is a statewide nonprofit that works to reduce poverty and improve opportunity for all children and families through advocacy, primarily at the state level, on topics including early care and education, post-secondary education, tax credits, and adequate state funding for human services programs. CAS is the Annie E. Casey Foundation grantee for Kids Count for Connecticut, and we're a member of the National Working Poor Families Project. In addition to our policy work, CAS coordinates programs serving low-income families through partnerships with 100 community-based organizations statewide. These programs include the Connecticut Money School for Financial Education, free tax preparation, and access to benefits. CAS believes strongly in the importance of evaluating both public policies and the programs that we coordinate. We use results-based accountability, or RBA, to look at outcomes for policies and programs. CAS is a small organization with a big mission, so everything that we do is in collaboration with other advocates and service providers, and we really hope that we'll be able to collaborate with each of you going forward. So, why are we here at CAS looking at two-generation approaches? Two-generation strategies are an emerging field that's still being defined. It's not really so new, going back at least to the 1960s when the Head Start program started, and Head Start has a parent engagement component. There was more use of the term and more intentional programs at the federal level going back to around 1990. Two-generation approaches address the cycle of poverty by providing learning opportunities and supports for both the parent and the child from the same point of entry. We think about it less as a whole new approach or even new programs and policies, and more about a new frame or lens that brings together child and parent programs, policies, and systems to create better outcomes. The reality is that if children live in families, and it's tough for kids to do well if their parents are doing poorly. We've been making great strides in Connecticut with early childhood initiatives, child health insurance, and nutrition. In 2011, Connecticut passed a state earned income tax credit, or EITC, that's among the highest in the country. The federal EITC is the single most effective anti-poverty policy, lifting 6 million people, more than half of them kids, out of poverty each year by encouraging work. Although we're doing a lot of good work, we haven't yet turned the curve on poverty, and especially on child poverty. In fact, our Kids Count data shows that over the past 25 years, childhood poverty in Connecticut actually increased by 50%. Poverty is the leading indicator for many social issues on education, health, income, wealth, and more. Two-generation strategies seek to break the cycle of poverty by reorienting systems, policies, and programs. We really need to look at and do things differently if we're going to turn the curve in trends on poverty. Many of us have been engaged in advocacy, education, and social services for many years, and it's frustrating that we're not seeing better results. And the fact is that no big new investments from government are likely, and in fact cuts are more likely, especially at the federal level. So we need to do better with what we have, measure outcomes, and reallocate existing funding to programs and policies that we know have proven results. We'll talk today about what two-generation strategies are, the problems they seek to address, some model programs and results, what's happening nationally and in Connecticut, and our perspective as policy advocates for children and families. This webinar is an introduction to two-generation strategies. There's a lot happening around this topic right now, which we'll cover briefly, and we hope all of you will continue to engage on two-generation issues through your advocacy and work in the community. In many ways, when it comes to two-generation initiatives, Connecticut's ahead of the curve. We have strong programs that provide great opportunities for children and families. Some of them are listed on this slide, and there are others as well. Each program plays a valuable role in advancing Connecticut families. We will include links for these programs when we post the PowerPoint on the CAS website and send it out to you if you want to learn more about these programs. On the policy level, Connecticut is among the first states in the nation to pass two-generation legislation, which was included in the Budget Implementer Bill earlier this year. The Commission on Children advocated for this legislation, which created a policy work group, and that policy work group is meeting now, putting together a two-generation plan that we'll discuss later in the webinar. We know that when families are subjected to the stressors of poverty, it has an enormous effect on both parents and children. The stressors are many: jobs with inflexible and unpredictable schedules and insufficient income. For those parents who lack education, there's little opportunity to change their work. The lack of high-quality early care and education, especially infant and toddler programs, often prevents undereducated parents from going back to school, whether for high school completion, English as a second language, or higher education. The struggle to manage from day to day leads to inordinate amounts of stress on both parents and subsequently on children. I'm now going to pass the microphone to my colleague, Liz Fraser.
I would like to share a story about how this problem plays out in real life with an actual person whose name has been changed. At 16, Sasha had had enough of school. She had always struggled in classes, and as years went by, she also had some social issues. She was teased, and eventually, as she got older, she was bullied, both in school and through social media. Unfortunately, home too was a difficult place. It was a single-family household. Her mom was working several part-time jobs with odd hours. Her mom was stressed and anxious, and it was very chaotic and quite a bit of yelling. Often, Sasha needed to stay home from school to take care of her little brother, who had asthma. The family struggled to get by, and due to several reported incidents, DCF was involved with the family. So picture a sad young woman needing support and love and feeling stupid in school. She was picked on and depressed, and eventually she dropped out. About a year after she left school, she delivered a baby girl, Janelle, and she was the perfect little baby and the love of Sasha's life. Unfortunately, the relationship with the young man quickly collapsed under the pressures of family, and she found herself pretty much alone with no high school degree, no driver's license, not to mention a car, mostly living at home with mom, but when things were really bad at home, she and the baby would find a friend's couch and try to come up with a plan. So why is this story important? It's important because it's not unique. In Connecticut, over 4,000 babies are born each year to a mother who has not yet completed high school. In addition, almost 8,000 babies are born to a mother who does not have any type of education past high school. This doesn't even include the dads in the picture, and we know there are many more dads that also are lacking educational opportunity. Economic opportunity for these families is limited. In Connecticut, there are also 80,000 low-income families with children under age 8. In 60% of these families, no parent has full-time year-round employment. In 80% of these families, no parent has an associate's degree or higher. In our slide here, low income is defined as under 200% of the federal poverty level. The jobs available for undereducated adults are generally close to minimum wage jobs. They mostly offer part-time opportunity with varying hours and little opportunity for advancement.
The national data demonstrates the same link between parental education and income. Even for those families that are employed full-time, without high school, there's a much greater chance that the family will be low income. The numbers improve dramatically as education increases. This chart shows that when parents have less than a high school education, 73% of their kids are low income, compared to 46% of kids whose parents have a high school education and just 17% of kids whose parents have some college or more. Educational attainment has a clear impact on parental income. Educational attainment also has a clear impact on parental educational achievement, also has a clear impact on children's educational achievement. This slide shows 8th grade reading proficiency nationally, and the Connecticut data is very similar. In this chart, just 16% of 8th graders whose parents have less than a high school diploma read proficiently, compared to 21% of 8th graders whose parents are high school graduates, 35% of students whose parents have some college, and 49% of students whose parents have a bachelor's degree. There are additional barriers for low-income parents, including transportation and housing. This slide looks at one more, childcare costs. In Connecticut, the cost of full-day care for 2 children is $1,750 per month. That's the third highest rate in the country. $1,750 a month is more than the current minimum wage in the state. It's the equivalent to full-time at $10.10 per hour. Our minimum wage is going up to $10.10 in 2017, but right now it's at $8.70. Also, there is a child care subsidy program called Care for Kids, but the maximum copay for Care for Kids is $200 per child per month, and there's a huge benefit cliff when parents' income rises. And of course, we can't forget that contributing to this problem are the huge disparities in our state on race and ethnicity. This is national data from the Annie E. Casey Foundation's Race for Results report, which came out in the summer of 2014. The biggest circle on the upper left is for Hispanics, and I'm going to compare that with the circle on the lower right for whites. What this graph shows is that 25% of kids in married couple Hispanic families grow up in poverty, compared to 6.4% of white kids in married couple families. It's even worse for kids that grow up in single-parent families. There, 57% of kids in single-mother Hispanic families grow up in poverty, compared to 35% of kids in single-mother white families.
So we've begun by talking about the problems of stress on parents. These stressors also affect children. We know that what happens in early childhood can matter for a lifetime. We know that early experiences impact the developing brain, that chronic stress can be toxic to a developing brain, that significant early adversity can lead to lifelong problems. But we also know that early intervention can prevent the consequences of adversity, and that stable, caring relationships are essential for healthy development. In Connecticut, we recognize the importance of early childhood and subsequently have done much work in getting early childhood into the state. However, as Lindsay Chase Lansdale, a professor at Northwestern University, has stated, it is not reasonable to expect that the child be the only change agent in a family. So, for Sasha, her options were limited. Our present system of family support consists of a myriad of poverty reduction policies, funding sources, and unconnected safety net programs. Each has its own agency of oversight, its own access point, and varying required documentation. Parents can spend hours navigating this confusing and difficult process. Significant is that most of these supports do not have any meaningful connection. Some are directed at adults, others are directed at children, and rarely is there coordination and accountability for family need and stability. For example, in Connecticut, our temporary assistance for needy families will allow you to go back to school, but students must still participate in work activities. This can be very difficult for many to manage, considering their work schedules, that childcare is necessary, and that financial support is only available through TANF for short-term job training skills, not for long-term educational programs. We also know that Care for Kids does not generally cover education, only work activities. In addition, we know that there is a tremendous lack of infant-toddler care available in the state. Transportation is a barrier, and housing is a problem. For many young parents living at home with family members, the stress they experienced as children is multiplied. 76% of low-income kids live in households with a high housing cost burden, meaning that the family spends more than 30% of their entire income on housing. So many young people struggle to get by and are unable to go to school and instead get trapped into the inflexible, unpredictable jobs and insufficient income that we spoke about earlier. Well, Sasha was lucky because she found a program in Connecticut that was specifically designed for adult learners and for their infants and toddlers. It was one of the Even Start family literacy programs. This intensive two-generation model includes 5 components. First, adult ed classes, giving parents the opportunity to achieve their educational goals. Second, accredited early education for their children while parents are in class, often in the same building as the adult classes. Third is peer learning, including 3 important pieces: child development information, the importance of early literacy, and also, most important, the connection to the community supports that help to eliminate barriers to success. Fourth is the interactive literacy component, which is time that parents spend in the early childhood classrooms and in the community in mentored learning environments. They take information learned in the peer learning classes and engage in activities specifically designed to connect parent and child. Last, there's 1 home visit per month, designed specifically to bring literacy and literacy activities into the home, bringing school into the home. So in addition, these programs are required to use community supports to reduce barriers. The duration and intensity of services must be at a high level. For example, Even Start families participate about 20 hours per week in the adult ed and early childhood classrooms as compared to the general adult ed population, which spends about 20 hours per month in classes. And also, there is an intensive evaluation system that measures outcomes for both parents in their adult ed classes, children in their developmental progress, and across the family. So Even Start is just one such program in Connecticut that addresses the need of parent and child together, and we mentioned some of the other programs earlier. All of these programs can contribute to the educational and economic success of children and parents together by coordinating services that strengthen the whole family. In the same way, policymakers need to build systems and policies around families, breaking down silos and building bridges among different funding streams. The Annie E. Casey Foundation is among many organizations that have recently released reports about the potential of two-generation approaches to poverty reduction. The Casey Foundation approach, as well as that of Ascend at the Aspen Institute, has a clear model of strengthening the whole family. This diagram is from Casey's recent Kids Count report, Creating Opportunity for Families, a Two-Generation Approach. This will be posted on the cause website. In this diagram, we see 3 different buckets that help to stabilize and strengthen the whole family. On the left is the adult piece, the financial stability, providing education and job training, providing access to income and work support benefits, financial coaching, and also access to affordable financial products. On the right, we have the early care and elementary education piece, which means access to high-quality early education programs for these children, successful transitions to preschool and elementary school, quality elementary school experiences, and effective teaching in these programs. The middle bucket is the connection. We need to have parent involvement and treat parent as assets and experts on their children. We need to have culturally competent staff members that are mentoring parents and children. We need to address family stress, and we need to enhance social networks to help families to reduce barriers to their success. We need to recognize that each of these buckets needs to interconnect, not operate as standalone components. And as we begin to connect them, we need to make sure we assess results for both parent and child, not one or the other. To ensure better outcomes, policymakers and funders need to provide adequate resources to evaluate the effectiveness and efficiency of coordinated programs. Regarding this evaluation, we have much work to do. The diagram shows data for Connecticut Even Start because it is one of the few programs for which we measure child and parent outcomes and their interactions, and even this data is limited. In this graph, we can see that Even Start parents had stronger gains as compared to all adult education students. So even with children and varying schedules, the Even Start parents were able to have stronger results towards their educational goals. As far as employment and income, with the Even Start population, full-time workers increased from 9% to 24%. Part-time workers increased from 21 to 30%, and income increased by an average of 40%, or $12,000 per family. Parents were also shown to engage with their children and their children's school. 96% of parents talked to their child about school daily, and 94% had routine contact with their child's teacher, which we know is very important to a child's success in school. And this study was a longitudinal study on the effects of Even Start that was done by the Yukon Center for Economic Analysis. So getting back to Sasha, when she began this program, she was not different than many of the participants that have been in this program. It was really only about getting her education, and she needed the free childcare for her infant to do so, and she was willing to participate in the other components to get the childcare. However, what she came away with was much more than her high school degree. Typically, parents come into the program thinking it's not really important to be constantly talking to a baby. Singing and nursery rhymes, reading to an infant, a waste of time. They will eat the book, and how does that help? And they just throw it, and it's really frustrating. It's just a baby, and they don't understand anyway. But over time and with patience, what Sasha discovered was the importance of her role and the meaning of literacy, how to be her child's best and most important teacher and advocate, and how to be a positive influence in her child's life. She was given more than high school. She was provided the time and space to connect with her child. Intentional two-generation programs, and as I said, this one is just an example, an intentional two-generation policy lifts parents by giving them the opportunity to achieve their educational and workforce goals. It lifts children by giving them a strong early environment while their parents are in school or working towards goals. But most importantly, it intentionally connects parent and child. It offers parents the experiences that might have been missing in their own childhood and equips them with the information and tools that will help them to be that guiding and positive force in the life of their child.
Liz has been talking about how two-generation strategies have a holistic approach, and that's part of their appeal. This diagram from Ascend at the Aspen Institute shows how all these different components work together. It shows the cogs of early childhood education, post-secondary and employment pathways, economic supports, health and well-being, and social capital. All of these things working together can make a huge difference. In recent months, there have been excellent reports released about using a two-generation lens for workforce development from the Working Poor Families Project, on healthcare and early childhood, and other topics from the National Center for Children in Poverty, Ascend at the Aspen Institute, and others. Janice Grundell, who many of you know, authored a paper for the Center for the Study of Social Policy earlier this year that reviews various approaches to two-generation work, including that of Ascend and the Annie E. Casey Foundation, as well as the Moms Partnership in New Haven. We'll include a resource list of materials, including all of these reports, on the materials that are posted on the CAUSE website. Part of the appeal of two-generation approaches for CAUSE with our mission to reduce poverty for children and families is that while many programs are effective at reducing poverty, things like the Earned Income Tax Credit, early childhood education, and unemployment insurance, there's not much evidence that any of these programs working independently will deeply reduce poverty beyond the current results. We've been stuck at about the same rates on poverty for about 30 years, and a new approach is needed to have a deep impact. There's hope that two-generation strategies can also begin to close the widening inequality gap to turn the curve in results-based accountability terms, since parental resources shape a child's adult outcomes. They also have the potential to reduce the educational achievement gap. Clearly, two-generation strategies are a direction that many practitioners from different disciplines and many funders are embracing. As advocates, we want to keep the focus on outcomes for children and their parents. We don't want a flavor of the month, but an approach that will create lasting differences for the child, for children and families most in need. Fortunately, Connecticut is headed toward long-term and systemic change because the state is one of the first in the nation to pass two-generation legislation due to the work of the Commission on Children and its executive director, Elaine Zimmerman. The Commission on Children successfully pushed legislation in 2014 to create a two-generation plan for school readiness and workforce readiness. The Commission invited advocates and practitioners to participate in a policy working group that's currently meeting. The work group is looking at early childhood programs for kids birth to 5, as well as adult programs, including high school diplomas, adult education, and employment skills. It's also looking at other issues that impact low-income families with young children, including transportation and housing. So, what's happening now? On November 12th, the Connecticut Association for Human Services and the Connecticut Commission on Children co-sponsored a forum on two-generation strategies at the Capitol. You can find links to the CTN video of this forum on the CAS and Commission on Children websites. The forum included a presentation by Sarah Griffin, a senior consultant with the Annie E. Casey Foundation, on the new Kids Count two-generation policy report. There were also respondents to that presentation, issue area experts from a number of disciplines, including workforce, adult literacy, and more. The forum also included the voice of for parents because we strongly believe that it's critical to have parents help design and implement programs and policies. As a parent advocate at the forum said, nothing for us without us. We don't yet know what will be in the two-generational policy workgroup report, but it will include best practices from Connecticut and the nation regarding two-gen education-oriented strategies, and it will also look at systems, policy, and programs, as well as data collection. There will probably be some focus on how state agencies should work together and with nonprofit service providers. Moving forward in the short term, it may be a challenge to obtain new state funding for two-generation strategies because Connecticut is facing a big budget deficit. However, the Commission on Children, CAS, and others plan to leverage private funding to advance two-generation strategies in Connecticut, and we're certainly hopeful that we may be able to obtain some funding. We're fortunate that both the Senate and House Appropriations Committee co-chairs, Senator Beth Bayh and Representative Tony Walker, who participated in the forum on November 12th, are very receptive. Their professional backgrounds for early care and education for Senator Bayh and adult education for Representative Walker give them a unique perspective on the value and potential of two-generation strategies. One thing that we really like about 2Gen is that it works in many different ways. It has bipartisan appeal, in part because two-generation is a lens, not a specific program. It also has intuitive appeal. People understand that children do better if we're also helping parents do better. We've talked to our colleagues from across the country, and we know that 2Gen is working in red states as well as blue states, purple states too, in part because There is an emphasis on effectiveness. 2Gen is very outcome-oriented and data-driven, and it also looks at efficiency. How can we reorient existing programs, not necessarily create whole new programs, but bring together different programs that already exist to make them work better together.
So in closing, Sasha was involved with her particular program for well over a year, and I don't want to give the impression that it was easy sailing. There was a time when it became too much for her, and she took a short break. But she came back to the program, and she was welcomed back. Sasha went on to complete her equivalency. She and her daughter are not DCF involved. She is attending classes at Capital Community College. She's working, and Janelle is in a Hartford magnet school. Sasha would like to write and make films one day. And I'm not saying that everything is perfect, but she and her daughter are on a different trajectory. At CAUSE, we believe that strategies to combat generational poverty must include generational solutions. As we provide for children, we need to equip their parents, especially those that have been disenfranchised by our educational system, with the workforce skills and the wraparound supports they need to be successful in their lives. As we provide for adults, we must ensure that parenting supports and high-quality early experiences for children are also included.
Thank you so much for listening to today's webinar on two-generation programs. We would like to invite you to learn more about this by joining CAUSE's lists, one for early care and education and another for family economic success. If you're interested in joining either, please contact Liz Fraser or me. Our email addresses are shown here, efraser, F-R-A-S-E-R, @cause.org, and JHORAN @CAHS.org. Thanks very much for your interest in this topic. We look forward to working together with you.